Hey everyone, welcome to the Psych to Practice podcast, your one stop for practical and useful clinical information, masterful insights from experts in the field, and a guide to daily living. I'm Ray Christner, and joining me as always,
Paul Wagner.
And Paul, today we're going to kind of maybe have a little lighter practice in action episode than we've had in the past few.
Yeah, we were talking, and kind of the genesis of this came from looking back and seeing a lot of the heavy topics. And I think, so often when we're talking about, mental health, we attend to the things that are a struggle and things that are challenging, which is really useful, but it can also be really draining and really, really challenging to kind of just always attend to it in that way. And so, wanting to really kind of also offer that other side of things where it's, how do we make sure that we're appreciating those small wins and we're actually like sitting down and attending to it instead of just moving on to the next thing, because I think it's such an easy part to miss. Yeah.
And I think something really, from a practice in action standpoint, I think clinically, we need to do this more with, patients we see, but I think also just for ourselves as we're working in therapy is, we're all looking for that final outcome. We want anxiety to be lessened, or we want mood to be lifted, but there's so many little moments that come along that if we pay attention to, it's a motivation in and of itself. So, I mean, it's sometimes hard to get to that end outcome. But if we do celebrate those little wins that happen, and not only celebrate them, but I think clinically, if we point them out to people, because sometimes I don't think they're as obvious to people and they go, oh, it's not a big deal. But I think as we're changing behavior, it's a big deal.
And, I think a part of that is there's this push of like, I don't want to sound like I'm bragging. And so people that are like, and almost there's a mentality that comes along. So it's not even just, I'm not saying it, but I'm not giving myself the permission to even feel like I should brag. And so, there's one of the individuals I work with said, and I absolutely love it. And it's don't humble yourself so much that you starve. And I think that it happens. It's, but I get it done better, or, it's great that it's finished, but it just doesn't seem quite right. And it's like we pick it apart before we ever stop and acknowledge, hey, I got this done, or hey, I started. Just being able to recognize what change looks like for us, and celebrating the change. Yeah,
it's an interesting dynamic that I think we create in mental health, in that when we talk about things, we do feel like it has to be heavy sometimes. And it's interesting about this idea of being too humble, because I've had people that minimize those wins, and even some that have been embarrassed by them and went, oh, come on, you really think I should celebrate that I got out of bed today? Like, people do it every day. And I always say, can't compare that. I kind of date myself, but I think probably the greatest basketball player of all time was Michael Jordan. That was what I grew up with, and still kind of hold him above everybody else. But I remember seeing an interview with him, and I'm probably going to not get the quote right, because it was, I was probably in college, but I remember him saying that, every day he doesn't compare himself to anybody else. He just wants to make one more shot than he did the day before. And that it was always about this little kind of step that he took. And, I tell people all the time, our goal is not to become Michael Jordan, right? We're not going to try to reach his percentage. But man, if you made one shot today and tomorrow you made another, that's awesome. That's a wonderful thing we got to look at. And I think we can do that in so many aspects of life and in treatment, that again, is it something that we want to be like, oh, this is the greatest thing that ever happened? No, I don't think we exaggerate it, but to say, you know what? I'm good. I did one little thing. I did get out of bed today, and that's better than I did for the last 3 days. And that feels good.
An earlier episode, and this was a while back, but we talked about, wanting to create confidence, for those that we're working with. And I think this goes hand in hand with that. Sure. Of if we only judge it by perfection, that's the standard, damn, if that isn't hard to meet, if impossible to meet. And, there's so many, I'm just kind of going through the Rolodex of like circumstances in session where it comes up. If it's like, yeah, no, I'm struggling with this. And, we'll talk like, hey, like, well, what made it enjoyable or what made it more positive in the past? And like, then they kind of get into this reminiscing mode and they're like, oh, well, like, I used to kind of do it like this and I'd add my own little personal spin and it's like, it was just for me. And like, but, then it's like, I just kind of fell off of it. And it's like, well, you had a great time when you were just telling me about this. Like there's a spark, there was an energy. Like, why didn't you share that? Or why did that fall off? And it's like, oh, well, like, I just thought it was bothering someone. That's like, why do we think that about ourselves? Like, why do we want to kind of squash that before we ever give it a chance to like really flourish? And I think that's another part that, encouraging and challenging our clients to take some of those kind of healthy risks of, hey, share your accomplishments. If it's in the therapy setting, phenomenal, but especially if it can be sharing it with people in their lives and not just their typical people, like, share some of the wins that, hey, I wouldn't expect it to share with my coworker. I wouldn't expect to share it with, my professor or, whomever, like being able to like have a sense of accomplishment and getting some of that positive feedback and someone else having that positive reception can be such a valuable tool.
Yeah. It's interesting when you're talking about that. I wish I would have thought about this prior because I remember reading a research article, and I'm going to say it was probably like an early 2000s research article. And it was specifically about dieting. And what they looked at was, when people talk about their diets with other people, how much more that increases their kind of adherence to the diet and their satisfaction with the diet, and their ultimate success. They're ultimately that they do well. So the recommendation was talk about it. Say, yeah, hey, I'm working on this, and so today I'm just going to have a real light lunch, and like literally verbalizing these little steps that we do. And the fact that for most people, they're going to be like, hey, that's great that you're doing that. And there's that dialogue and thinking of all these little pieces that we do, how motivating it is. But I remember when I read it going, I don't really do that with other things. Like no one goes, hey, I'm in treatment for depression. And but maybe why not? Like, why aren't we kind of going, hey, like I'm working on myself. And, so to do that, I'm going to try to do this different today and really giving ourselves that ability to talk about it. And maybe that starts just in the therapy session. Maybe that extends a little bit to family and close friends, but maybe that can even go further. I mean, I think, we are seeing more people willing to talk about personal growth and the steps that they're taking to enhance their lives. That's, I think an important part that we could try to give people a good way to do that.
And, I think certainly there's some hesitancy, like, and a part of that going back to like that, almost like that bashfulness. And when I talk about it and encourage this with clients in the therapy office, so often it's I don't want to feel like I'm bragging. And especially like if, at the top it's like, oh, hey, yeah, I know I got a promotion or I got a raise. And I was like, that's awesome. Have you shared? It's like, oh no. Cause like, I don't want people to like look at me and feel like I'm like just flaunting this. And it sparked this really interesting discussion. And I think every time it kind of elaborates or we kind of create our own discussion with it of like, can we validate the process that it took for us to get there? Not necessarily even the end outcome. We can be proud of the end outcome, but like, if we can talk about like, hey, like, I'm so thankful, I put in the effort and, I didn't know how it was going to go, but like it went well and I'm so happy. And like, I have this to show for it. Like, and in fact, like earlier on this week, I was having a similar conversation. And I had a client pull down an award that they had in their office and like, you're the second person I've ever showed this to, other than my office mate that when they had gotten it at the point, like I didn't tell my family, I didn't tell anyone that I got this award. And I was like, why the hell not? Like, and we were like, it became this excellent conversation. And I just wanting to kind of encourage even more of like, we work so hard, make sure that we acknowledge it and make sure we experience the gratification that comes along with that hard work.
So I guess I'm kind of curious as we're talking, is is part of this that through development, we don't teach people the right language to talk about their successes. And that when they do, it then feels like this negative thing. Like, you've said a couple of times, like they feel like they're bragging or, they're narcissistic or whatever word people assign to it. But I wonder maybe if part of this is, do we therapeutically need to give people language to feel comfortable in talking about their successes? And I've heard it both ways. So, I've heard people that brag about things that they do. And sometimes that's done well and sometimes it's not. And then I've heard people who talk about their accomplishments and it never comes across that way. Like they're very skilled in it, So I wonder, like, how do we help people with the language? You were talking about like getting a raise. Like, I think probably if you went, hey, my salary is now 6 figures. Yeah, boy, it just doesn't feel good. It's not going to come across good. But to say, man, I'm really thankful that, I've been really working hard and my employer recognized it and, gave me a raise. And man, I'm really appreciative of that. I think it's a way to acknowledge it, celebrate it, and do it in a somewhat humbled way, but not too humbling.
Yeah.
I don't know. What are your thoughts on that idea of language around this?
Yeah, I know. I think it's so important. And in some ways trying to capture what is the value of sharing it? And is my language reflecting that? So is the value for me to kind of self-inflate a little bit? And I guess another part is, how am I doing that? I'm like, oh yeah, no, for thinking of sports, like, oh yeah, I absolutely destroyed that person. Like, they didn't even stand a chance. Like, that's just not, if we're inflating it by putting others down. But if we're like, hey, like that person, they put up a hell of a defense and it took everything I had to try to outmaneuver them. And like, it was tough.
Right.
Same outcome, but the way we were expressing that has two very different experiences, and we can build others up while we build ourselves up. And I think, making sure it's warranted, I don't want it to just be, it's this kind of, if we're sharing praise, I want to make sure it's praiseworthy, and I don't want to just share praise for the sake of praise. Yeah. But also at the other side, let's not have like too high of a barrier there that says, oh, me getting out of bed isn't praiseworthy or isn't, worth like celebrating the accomplishment, or like, hey, it's been a struggle for me to pull myself out of bed and like my alarm goes off and I just sit there, contemplate, and I chose today, I'm getting up.
Right.
Like, yeah, no, that's celebratory.
That's right. Progress is the key. It's really focusing on that. I have this adolescent who I see who great kid, senior, I've seen him for several years off and on, and has ADHD, some executive function weaknesses, and his Achilles heel is homework. Like, turning in assignments it's been the ongoing discussion. We're always kind of revamping things. And, it's interesting, as a senior this year, he came in and he was just like, you're not going to believe this. I only am missing 3 assignments. Like, it was like, he's like, I've turned in, like in a week, I've turned in like all the stuff I was supposed to do. And his like just excitement was, and I said, and he almost kind of twisted on me and he went, but, I still have 3 more. And I'm like, oh no, pause. Like, listen, I've known you for a while. I remember when it was 25 assignments that you had, that you had to do. And this is awesome. Like, so what did you do? Like, tell me about it. And he was like, and he was able, kind of using your language. He was like, yeah, I figured out how to work different. And then he started talking about this strategy that I had nothing to do with therapeutically. He came up with it on his own, and it just was great for him. And, celebrating that with him was so huge. And, it was a day later, he was like, I took the plunge. I don't know anything now. I got home and I was so excited about the fact that we talked about this. And he's like, I was just like, he's like, I loved it. And yeah, I think I'm not his parent. So, I didn't say, hey, you still have those other 3 due. We did celebrate that piece. but the momentum that created for him and the lift that came out of it was great. So, I mean, I think, we got to celebrate the progress that we make and not the perfection. We still might owe homework assignments. We still might sleep in on days, but that doesn't mean we're not doing better today than we did yesterday, or we're not taking a different effort today than we did yesterday. And if we can get people to think about it and talk about it, and maybe even just tell themselves that for a second before they even tell everybody else, it's still a way to celebrate it.
And, going back, the comment you made about it is experienced differently if we're portraying it as progress. And, another part that I oftentimes pair with and try to encourage, my clients that I work with is tell it as a narrative. Like, just don't say again, the accomplishment, or even don't say like, oh yeah, no, hey, I was late, but now I'm not. Like, I want to hear the story behind the process. And I guess like the progress and process are like the two elements that if we can encourage those, and if it's in a narrative or even the way that we think about ourselves of like, where was I at? What was my process at, for getting to where I'm at now, and what's different, and, what do I have to show for that? And I think if we can encourage that type of language in our clients, and they can then start to recognize change, and it's not maybe gargantuan change, but it's that incremental change. But, almost so many, one step, the hardest step is the first one. And it's just trying to kind of create momentum. And, we can go on to do gargantuan things, or maybe we stop it there at the little success, but it's still success. Yeah.
And I like the idea of the thinking of this process narrative, because I think the other piece that, maybe is not really what we're talking about for this episode, but, I think when we tell the narrative and we appreciate or celebrate that little win that we have, no matter what the size, it also lets us extend the narrative to what's next. And, so, I mean, it's funny because as you were talking, myself, I know kind of my internal dialogue that happens. And when I kind of go through this, I do almost talk it out in a narrative where like, hey, I did this, this, and this. And from that, I achieved this. And I think tomorrow I'm going to try to add this to it. So it's like the story doesn't necessarily end. It gives us this kind of next step to take. And maybe that next step is, man, this really worked. I think I'm just going to do the same thing again. But now we start having solution. We start having this move forward with that narrative. And, we've said momentum a few times, but it's not just the celebration that creates the momentum, because we've all done things that we felt good with, but without a further step forward, it stalls and it might not work. But if we do it in a narrative and we create that step forward, if it's the person that wants to improve their basketball shots and they say, today I took 100 shots and I made 50 out of 100. And tomorrow I'm going to take 120 just to add a little bit to it. It's a step forward, whatever we want to put into it. But I think that's important. It's not just, hey, I did this. It's, if we use your example of the getting a raise, same thing. It's, hey, I've worked hard. I'm thankful that my company recognized that. And, next year, I think I'm going to even try to accomplish this. And, we put that kind of plan forward. I don't think we can discount that enough, how much that actually takes us to the next level.
And I think what's nice about framing it as the narrative is it doesn't have to necessarily be linear with that task or goal alone. And, in fact, this was a few weeks back, but I remember using it as a personal disclosure example of, being able to accomplish something and how it doesn't have to necessarily be related at all. And it was 2 holes in my family room ceiling for like a year, and finally got around. It was on the calendar, and like, I'm not good at patching drywall. Like, I can notice the spots after painting, and I'm like, but after getting the quote for getting it repaired, I was like, I'll give it a try. I'm willing to spend the cost of materials to get and spend a couple hours on YouTube and see if I can give it a go. And it was a process, and I'm sure it was not done in the way that, a professional would have done it. But afterwards, and I stepped down from the ladder and like looked up, I couldn't tell where the patch was. And I cannot tell you how many people I brag to about that. I was just this, I'm doing it right now. I'm sharing this accomplishment here on the podcast, but it then sparked, like, I'm not starting a drywall repair company. I'm not, punching holes in drywall to go do it more, but it then sparked momentum to go and carry on and to, complete other tasks and do things. And it was like, man, that was something I felt was challenging. I didn't really feel all that confident, and look at what I was able to do. Wonder what else. And again, it's that narrative that can then momentum can then be almost in any direction we want to take it.
Yeah. I think anybody that does cognitive therapy, recognizes that the importance of attending to that, internal dialogue or that self-talk that we have. And, this is a way to really, I think, attend to it in a way that, we add that reinforcement, that positive feeling, but we also then again use that self-talk to get us to the next step. And it doesn't have to be linear. I think it can, and I think that's the great part about appreciating wins. Sometimes, it leads to something else. If you have a kid who maybe picks up one part of their room, maybe that leads to them doing another part of their room, and maybe that leads to another. And eventually, maybe we get more things cleaned up and organized because that little momentum happens. If we just looked at it as, oh, your room has to be completely clean, it can be overwhelming for some people. And I think, just like your drywall project, right? Like it's like you put it off. And then now it's like, oh, what's the next home repair I'm going to do? Yeah. And then all of a sudden you get a bunch of things done. And maybe that doesn't last forever, but it does give us these pockets of really good wins. And I just think it's so important for when we talk about wellness that we get people, especially those who are vulnerable because of anxiety or depression, or they get into kind of those negative thoughts, to really help get that focus, because that's a good part of the treatment. It's not just trying to minimize the negative thoughts. It's also, how do we create that dialogue that focuses on the good things that happen?
And one way that I like to do that especially with my clients that are kind of, let's say, struggling with more that's like just self-depreciating depression, or, that hesitancy and avoidance with anxiety, is I try to challenge them. I was like, hey, we're going to role reversal here. I'm going to argue why you're struggling, and I want you to argue my perspective of why I think you're doing, a great job. And it puts it on them, and, they're able to then think in the way I would think about the situation. And then, they're able to usually do pretty well. Like, well, you would say this, you would say this. I'm like, okay, yeah. Do you think it has a point? And so it's just kind of interjecting a little bit and having them not only say it, but then sit with it. And then I put their argument. I'm like, I want you to argue against me. I'm going to put out what I think you would say. You need to then argue. And so I think we can also build appreciation through just varying perspective taking, and being able to just kind of acknowledge saying, hey, even if you don't view it as a win, if I'm celebrating it as a win, why not get some of the good stuff there too? And allowing and encouraging them to kind of acknowledge that for themselves. And I mean, that's the ultimate goal, but even if we can model that, I think it's a phenomenal skill.
I love the idea of getting them to argue back. I often find in therapy that we make better changes when we do that, because I think it's in our own head, we're only hearing one side of the argument. And I always give the example. I'm like, listen, your negative side's screaming and the positive side's whispering. And at the end of the day, if your perception is going to be the side that's screaming is winning the battle. So how do we even that out so we can have the same volume? And so I do the same thing. I'll say, listen, I want to argue. I don't want you to tell me what you think I'm going to think. I want you to argue why it was good. And I'm going to be the counter, and I'm going to escalate it, and I'm going to keep pushing. And it's always amazing to me, because it's such I think a experiential kind of thing for them to start hearing themselves arguing positively for themselves, and to have to do it. And sometimes they get caught up. Sometimes I'll push it and they'll be like, I don't even know how to respond to that one. That's okay. But the more we practice that and externally practice that, the more then it becomes easier to do it internally. I think in therapy, it's not enough for us to just tell people, hey, when you happen, you got to argue back with your thoughts. Now we got to get those out. We need to hear what those sound like. And when people hear themselves advocating for themselves, that's a win. There's a win right there where they go, I don't think I've ever done that. I just had somebody not too long ago in counseling go, I've never argued for myself as hard as I just did. Yeah, how did it feel? Like, what was that like? It's like, man, I want to do it more. I want to, and I'm like, listen, you're just arguing against yourself right now. Like, how do we keep doing that? So it became a lot of practice, but getting that out there. And again, I think that goes back to something we said a lot earlier. When we do that, we now give people the language and we can help them. And I've even stopped midway through and went, all right, here, what if you said this? Like, let's put some different ways to word it. How's that feel different? How does that change what you think? And it becomes this kind of just interesting dynamic. And, I find adolescents have a little harder time wanting to do that. They don't like this, but adults, man, I'll tell you, we've had some incredible progress seeing that, and then they can argue and appreciate those wins a little bit more, I think.
And it doesn't always happen, but man, if I can get stumped when I'm trying to argue their point, I'm trying to really try to challenge it. And we stop and acknowledge, I was like, I'm at a loss for words. Recognize what that means. Like, recognize what you just shared and what you just said there about yourself. And and it's such a powerful moment. And, being able to encourage that. So the language, challenging the thoughts, and kind of giving it space and room to breathe in the therapy office, and as well as making sure we're generalizing it outside. So like encourage, like, hey, do this, do this at home, do this at work, argue the other side of this. So that way we're not just, it's great if it happens in the therapy office, but it's also, if it just stays there, it just means that the therapy office is doing great, but these other areas aren't. So how do we generalize it to other aspects? Yeah.
Yeah. I mean, I think, and I think the other piece I would just kind of add in there is, when I think sometimes when we're working with people who might be experiencing a kind of a more severe level of depression where their self-doubts a lot, as therapists, we also have to be able to realize that even this appreciation has to happen in small steps. I think, when I used to do more like supervision, listening to tapes and, recordings of students, oftentimes we'd have people like, oh, this was really good. And their energy was really high, which was awesome. But the individual they were working with, their energy level was really low. And it was too different to appreciate it. That, so they I think their mindset, you could almost hear it where they could never get themselves that excited about that win. So I think therapeutically, we also have to be kind of cognizant of going, okay, let's not go overboard with it. Like we want to be that motivating, but sometimes it can be a soft acknowledgement as well initially, and be like, dude, that's awesome. Like that, you did great with that. You should be proud. And maybe it's at that level of intensity. And maybe over time we can get higher than that, but we also kind of have to recognize that. And I just want to bring that up because I think sometimes, while this is really positive, it can also backfire if the person goes, man, I can never be that excited about this. And then we reinforce another negative thought. So to be like, hey, you know what? I just want you to just, hey, lightly, man, just pat yourself on the back. This was good. You took a great step. And if they can just nod their head to that, it's a good acknowledgement. And then maybe next time we take it a little further, and, it's not going to necessarily happen in one session. And when we do that, I think it becomes easier to generalize. So, when we do that, and even outside of the session, that they can just take a little movement to appreciate a small win and don't have to be overly excited about it, but maybe they can just be like, wow, I did it again. This was another good day. That's okay. That's all we necessarily need. Maybe we ramp that up and we get there. But sometimes we got to meet them where they're at. I don't think we can forget that piece.
And one way, and I realize that, I don't want to derail from that because that was so well said, but like one way I think we can do that excellently is through humor and like being able to be like, to share. It's like, I'm going to hold off from bringing the parade in, but wow. And like, so it doesn't just necessarily have to be in I think the affect that we're expressing can be muted, but we can also express that like, hey, you kind of know I want to take it further, but I'm not. And I think even that can help to share a level of connectiveness. Again, not with all clients, but I think quite often humor is a great way of connecting and celebrating that and being able to kind of turn that moment into, it's, what do we do when we typically are feeling good? We're laughing, and it can feel like a moment of levity.
Yeah.
And I think like being able to offer it that is like appreciation with a moment of levity. And I think it can really hit home.
Yeah. I think that's another episode we should probably think about is the idea of humor in therapy. Because I think a lot of times people think that's not the case, but I mean, there's many days people I'm seeing, we're laughing about something and maybe crying the next minute. But sometimes that's I'm glad you brought it up because I do think that's a really important topic and it's a good way to do some of this. But I think it's also a whole other piece of therapy that we don't talk enough about. And it doesn't mean we have to be, stand-up comedians, but I think we can be real with humor. And I tend to use it a lot. And even in situations where it may not feel like it's maybe the time to do it, sometimes it breaks the ice and then it's like, oh, wait, okay, now let's reset and let's move to this. So
we can be people
that's right. We can be people. I think we're gonna have to mark that one. Maybe we'll do an episode here coming up on the idea of humor.
Yeah. Wow. Yeah. And I think that's a good place to pull back and, as that maybe one last reminder of just for ourselves as clinicians and for those that we work with, ensuring that we're celebrating those little wins and, we're not just letting them pass by. And with that, we hope you enjoyed this episode. Tune in 2 weeks. But until then, be well, stay psyched. The information contained in this podcast and on the Psych to Practice website is intended for informational and educational purposes only. Nothing in this podcast or on the website is intended to be a substitute for professional, psychological, psychiatric, educational, or medical advice, diagnosis, or treatment. Please note that no professional-patient relationship is formed here, and similarly, no supervisory or consultative relationship is formed between the host, guests, and listeners of this podcast. If you need the qualified advice of a mental health professional or practitioner, please contact services in your area. Similarly, if you need supervision on clinical matters, please locate a supervisor with experience to fit your professional needs.